Mayor Chad Bashinsky has said that he is open to revisiting the idea, but will defer to experts. The motion will be debated at a future meeting. As for right now, the city is set to add fluoride to its water at the start of next year. Dr. Gerry Uswak is an associate professor at the University of Saskatchewan's College of Dentistry, and his area of expertise is in dental public health. And he joins us now. Good morning.
Good morning.
So, before we dive into it, you heard from the counselor there. Let's get to a couple of the points that he made. One, he said that 95% of countries don't have fluoride in their drinking water. What can you tell us about some of the points that the counselor made? And specifically, let's start with that one, I guess.
Well, the community water fluoridation does vary where it occurs, who's using it. In North America, it's a municipal decision that both in Canada and the United States that the federal government can support it. Maybe they don't support it as much as they used to. And it's up to municipalities to decide. So if Regina wants to revisit that decision, that's, I fully support the democratic process as long as it's, based on facts and not fiction.
Let's talk about facts. What are some of the facts on fluoride in water?
Well, one, we know that, and we can stipulate to that fact that community water fluoridation is effective. It was chosen as one of the top public health interventions of all time, along with immunizations and car safety and firearm safety and a variety of other things. So it is effective. Some of the most recent, it's also a very political topic, right? You don't see protests about fluoride in toothpaste. It's always community water fluoridation. So there's that aspect to it, and it's very polarizing.
Why?
Well, because on one hand, you have science that says it prevents decay, prevents pain and suffering, and it's a positive thing and very cost effective. Less than $2 per person per year kind of thing. But it's controversial because some people see it as, it's been called mass medication, forced medication, right? It's in my water. I don't have a choice. So, that's ever since fluoride has been put in water, there's been political pushback, towards it.
When it comes to the benefits of adding fluoride, a lot of people maybe aren't able to go to a dentist. They don't have dental coverage. Is that part of the argument for this? Because we're saving, the system, and you mentioned off the top pain and suffering and tooth decay.
Well, absolutely. The whole. Understanding that fluoride can prevent cavities was, an amazing discovery back in the time. And then from the Kingston Newburgh, late 40s experiments, it showed, the preponderance of evidence showed that it was safe. So, and now what we're seeing from the research is not only that, all things considered, fluoride in water still has a significant preventive benefit. It actually is more effective in marginalized populations who face significant access to care barriers, low socioeconomic status, people who are geographically separated from dental care. So it does. From the dental public health perspective, it still is an effective preventive modality.